First, a new study that diet soda drinkers are not going to like one bit. NBC's chief medical editor, Dr. Nancy Snyderman, is back with details on this. Nancy,
hey,
good morning to you. Headline to me seems to be that diet sodas and foods with artificial sweeteners may be just as bad for people as the real deal, like regular sodas.
You know, this is not a great study, but adds to this increasing volume of work that we know that just because you use artificial sweeteners, it doesn't mean you can get by with consuming fewer calories. And there's some pretty good research that this may change how we, in fact, crave sweets. The artificial sweeteners are sweeter than actual sugar. So when you consume them as artificial sweeteners, your body almost wants sweets and craves them in a different way.
So it's not that they have calories, because they don't.
They have no calories.
It's that you then go off and crave other sweet things and eventually gain weight.
Right. And there's a pretty good link now that just because you consume these doesn't mean you're going to be healthier. And there may be now a link to pre-metabolic problems, diabetes, obesity, etc. They are not a cure-all. And in fact, let's be real. Whether it's a real soda or diet soda, it's a treat. And you should not even have one a day, a couple a week maybe.
All right, let's go to another study making headlines.
Yes.
This one from the University of Washington. It's a big study, basically on the health of this nation. You can find some good news. We're living longer than we did 40 years ago.
Right.
I find mostly really disturbing news in this study.
Matt. This is a real indictment of American healthcare. If you compare us globally, we rank 34th behind other industrialized nations. And if you crack it down then and look at county by county in the United States, this is almost death by zip code. Men in McLean, Virginia will live almost to 81 years of age. But if you go 350 miles to West Virginia, McDowell, West Virginia, the average lifespan is in the mid-60s, which is like equal to Gambia, West Africa. And so we're starting to look at real health care disparities. There's a poverty issue here, racial issue, and coming back to food insecurity.
We understand that women have a longer life expectancy than men, and yet the same county by county situation occurs when we look at women.
Yeah, if you look at women live longer in Marin County, California, and they live shorter lifespans through most of the South.
Places
Kentucky,
like Perry County, Kentucky.
Yes, exactly.
Much shorter lifespan.
Unbelievable.
So it's economics, it's poor diet, it's lack of exercise, it's smoking, and it's obesity.
And when you look at that difference of 85 years to 72 years, you can't just explain that based on simple math. You have to sort of say, what are the demographics there? And certainly poverty and food insecurity make a big difference. And I want to talk about the access to really good medical care. People who are poor, people who are hourly wage earners can't necessarily take the time off to get to the doctor. They're in rural areas, and so they don't have the same quality medicine anyway. And when you're hungry, and I've had people who've been starving before say to me, don't tell me to eat an apple. I know that. But you know what? That doesn't fill me up. A Snickers bar might. So until we really get to this food insecurity, we're not going to battle this. Increasingly, there are some cool programs out there. There's something called the Fair Food Network in the Midwest. It's allowing people to take their food stamps to farmers markets, and for twice the face value of those food stamps, get real food. That's how we're going to change this in this country.
I encourage people to read this study, or at least
it's
parts
sobering.
of it, because it will really
and
open up. I think a lot of it's obvious, and they
summer.
probably know it, but it's still shocking to read.
It's death by zip code.
All right, Nancy Snyderman. Nancy, thank you
You
very
bet,
much.
Matt.